osteostem.
Okay, ma'am.
Right. So if you've read and understood, considering its surgical pathology station, please tell me what is the differential diagnosis or what are the differential diagnoses you'll consider for this patient?
Okay, ma'am. It may be the familial adenomatous polyposis or
Very good. Yes.
hereditary non-polyposis colorectal carcinoma
Yes.
or hematoma.
Right. How would you confirm your diagnosis? What investigation would you ask
Taking
them?
history,
Yes.
examination, and the investigation. It includes the colonoscopy.
All right. Here, colonoscopy was done, and it was found to be that there was
Multiple
one
polyp
largest, yes, multiple polyps. So most likely diagnosis is
is
the
familial adenomatous
yes.
polyposis.
This condition is also accompanied with endometriosis. Can
Yes,
you
ma'am.
tell me why or what are the underlying cause that might have caused this condition?
Sorry, ma'am.
What might be the underlying cause that this patient has an underlying condition, endometriosis, along with familial
Yes.
polyposis?
Yes, there may be the extraintestinal manifestation of the FAP.
Yes, and
And there is also the risk of and the genetic cause also.
yes, and what are the theories which are involved which cause endometriosis?
Yes, endometriosis, there is a
Fine.
regurgitation
Yes.
theory, and another is the metaplastic theory, and the benign metastatic theory, and stem cell theory.
All right, four theories, right. Would you be able to tell me what are the genes which are involved or which might be involved in this condition?
Yes, ma'am, 3 genes. It includes the um, P53 genes, APC, mainly APC gene, KRAS gene, and P53 genes.
What are these genes responsible for?
Okay, ma'am. Loss of APC gene, it cause the hyperplasia, and
Yes.
the mutation of the KRAS cause the dysplasia, and loss of P53 genes cause the adenocarcinoma.
What can you please define adenocarcinoma? What is it?
When the malignant transformation in adenoma occurs, that is the neoplastic condition, that is the adenocarcinoma.
Can you
That means the adenocarcinoma sequence.
sequence? Okay, adenocarcinoma is one of the most commonly occurring colon carcinoma also. Can you tell me, can you please help me and define dysplasia?
Dysplasia is the disordered cellular development characterized by the increased mitosis, pleomorphism, but not invades the basement membrane.
Okay, can you please tell me, right, for this patient, how frequently would you ask for endoscopic surveillance?
Yes,
Who has
ma'am.
a strong family history as well?
Yes, those who have the family history of FAP, I'll advise the starting the colonoscopy at their early 12 years old and yearly
Yearly, very good.
up to the age of 30 years.
Please tell me what are the different types of adenomas you know about?
Okay, ma'am. It's the tubular, villus, or tubulovillus.
Okay, there is another classification like non-neoplastic.
Yes, ma'am. Neoplastic and non-neoplastic.
Yes,
Non-neoplastic includes the inflammatory polyp,
yes,
hematomatous, hyperplastic, and
metaplastic. Yes,
metaplastic.
yes, and neoplastic are What are the
Neoplastic
neoplastic ones?
includes the adenoma, here the villus, tubulovillus, tubular, adenocarcinoma, and carcinoid tumor.
Out of these adenomas, which one has highest chances of causing malignancy?
Yes, villus adenoma has the 40% chance of carcinoma,
Can you
followed
tell?
by
Yes,
tubulovillus and
right.
tubulovillus and
Thank you.
tubular.
Malignant potential of adenomas, it depends on certain factors. Can
Okay.
you name
Yes,
few?
ma'am. Yes, yes. It depends on the type of the adenoma. Villus is more frequent cause of the carcinoma than the diameter of the adenoma, less than 1 centimeter, 5% chance of malignancy, more than 2 centimeter, 20% chance of malignancy, and the rate of the dysplasia, degree of dysplasia.
Okay. Can you please help me and read this image?
Okay, ma'am. It's the colonoscopic view of
Yes.
the colon showing the
Yes.
multiple polyp in different size with ulceration,
Yes.
and there is no prominent polyp, no hemorrhage, no bleeding.
Yes. Can you define the term ulcer, please?
Ulcer is a breach of the tissue epithelial continuity.
All right. Okay. What lifestyle changes can you advise the patient which can help patient reduce the risk of colon carcinoma?
Yes, ma'am. Yes, I will advise the patient to stop smoking,
Yes.
limit alcohol,
Yes.
take the fiber containing diet, and take the uh, limited or low level, low fat diet.
Okay. Can you please tell me how the colon carcinoma can be classified according to which?
Yes, ma'am. According to the
Yes.
Duke's
Okay.
classification, Duke's A, it invades, not breach the muscularis propria. Type B, it breach the muscularis propria but not involve the lymph node, and Duke C, it involvement of the lymph node, and Duke's D is the distance metastasis. And the TNM classification,
Yes.
the T stage includes the T1 into the submucosa, T2 into the muscularis propria, T3 reach the submucosa but not breach the subserosa, and T4 breach the serosa or involve the adjacent organ, and N for lymph node, N0 no lymph node, N1 1 to 3 lymph nodes, and N2 more than 4 lymph nodes, and M0 no metastasis, M1 metastasis.
If you are told that patient's ulcer heals with secondary intention, what would you understand by this?
Yes, ma'am. The ulcer is not healed by primary intention. It occurs by reepithelialization and the contraction.
Okay, good. Right, and this granulation results in greater scar.
Yes,
Healing
ma'am.
process would be slow. And what
Yes,
else? Can you give some examples of healing with secondary intention?
yes, ma'am. If there is the wound that is not healed by the primary intention,
Yes, for example, like a pressure ulcer.
yes, pressure ulcer,
And
some diabetic ulcer, diabetic foot ulcer,
okay, that is example of pressure ulcers. There could be burns.
yes,
There
burn
could
ulcer,
be
ma'am.
poorly reduced fractures. And simple example, a tooth extraction.
Yes, ma'am.
Okay, right. What I want you to tell me, okay, time is gone. Thanks. Good.
Thank you, ma'am.
Thank you.
Thank you, ma'am.